Assalamu alaikum everyone, this is Zohaib Tahir from ZMeds, and today we are going to talk about cholinergic receptors, one of the crucial concept to get stick to the cholinergic drugs concept clearly. First of all, we will see the key differences between muscarinic receptors and nicotinic receptors. While muscarinic are G protein coupled receptor type of receptors in which secondary messenger will play its role by enhancing or inhibiting the actions inside the cell. While in case of nicotinic receptors, ligand will bind to the nicotinic receptor, and as a result cationic ion channels will be activated, and as a result calcium or the sodium or whatever the type of receptor is will get activated. Well, talking about the agonists, in case of muscarinic receptors, acetylcholine and muscarine both act as agonists to stimulate muscarinic receptors, while in case of nicotinic receptor, acetylcholine and nicotine are used as agonists. While talking about affinity, muscarinic receptor has the affinity for acetylcholine and muscarine, but low affinity for nicotine. While in case of nicotinic receptor, there is low affinity for muscarine, but high affinity for acetylcholine and nicotine. What about subtypes of muscarinic receptors? Well, there are M1, M2, and M3 receptors. While in case of nicotinic receptor, there are two subtypes, and M receptors which are present in muscles, and N receptors which are present at the synaptic cleft or at the end of the neuron, most probably preganglionic neuron and postganglionic neuron. Then we have muscarinic receptors. Well, M1 receptor are present in the gastric parietal cells, which are responsible for the release of HCl into the stomach and also in the CNS. While M2 receptors are present in heart and smooth muscles, and M3 receptors are present in bladder and exocrine glands. Muscarinic receptor mechanism is real simple. M1 and M3 receptors are responsible for the activation of GQ subunit that in response causes stimulation of phospholipase C, and phospholipase C increases IP3 and DAG, where IP3 increases calcium release and DAG further causes the activation of phosphokinase C enzyme for further intracellular actions. While M2 receptor being inhibitory in action and being present in the heart activates GI subunit. As a result, cyclic AMP will reduce, potassium conductance will increase, and heart rate will be reduced. So, upon cholinergic stimulation, there will be reduction in the heart rate. While upon the stimulation of M1 receptor present in the CNS and also present in the parietal cells, there will be increased secretion of parietal cells, that is, increased secretion of HCl into the stomach. So M1 stimulation will result in the acidity, while M2 stimulation will result in the reduction in the heart rate. What are the example? Well, there is one example given, pilocarpine, that is non-selective agonist for glaucoma and xerostomia. After that, we have to discuss nicotinic receptors, and the structure of nicotinic receptor is just like a pentamer ligand gated sodium channels. So we have discussed the location of nicotinic subtypes, NN, that is present in autonomic ganglia, CNS, and adrenal medulla, while NM receptors are present in neuromuscular junctions, which are present on the top surface of skeletal muscles and important for innervation of skeletal muscle in order to help in movement or contraction and relaxation. After that, we have the pharmacology of nicotinic receptors. In case of muscarinic, it was GI, GQ, and GS subunit to be activated, while in this case, there will be ligand gated sodium channels or calcium channels depending upon the location of nicotinic and depending upon the subtype of nicotinic receptors. So, nicotinic receptors are stimulated by low nicotine while nicotinic receptors are blocked by high nicotine. This is a very important point. Remember this. Low nicotine causes stimulation of nicotinic receptors and high nicotine level blocks the nicotinic receptors. So ganglionic blockers, hexamethonium also blocks the nicotinic receptor and neuromuscular junction blockers are tubocurarine. Mechanism is very simple that nicotine or acetylcholine while acting on the nicotinic receptor will result in opening of ligand gated sodium channels. After that, we have clinical relevance of these receptors that we have discussed. So M3 agonists for dry mouth are glaucoma. M3 receptor are present in the eye and in the exocrine salivary gland. So these agonist drugs are used for the dry mouth and to treat the glaucoma, while M2 agonists are present in the market which are used for the bradycardia. Why? Because M2 receptor activation leads to reduction in the cyclic AMP, increase in the potassium conductance, and a reduction in the heart rate. While stimulation of M3 receptor present in the smooth muscle of exocrine gland will result in the prevention of dry mouth by increasing saliva secretion. After that, the clinical relevance of nicotinic targets, in which NN blockers are used for hypertension. So when NN receptors will be blocked, the nerve transmission will also be blocked. And as a result, what will happen? Hypertension will be prevented as no impulse will be reaching the heart. But in case of an M receptor blockade activity, there will be muscle relaxation. Why? Because an M type of receptors are present at a neuromuscular junctions. When neuromuscular junction NM receptors are getting stimulated, what what is going to happen? There will be contraction of the muscle. And when there is contraction of muscles, muscle can remain in the spasm as well. So for the muscle relaxation, NM blockers are used that we will discuss in later on videos. Here is the affinity profile. In the A, you will see muscarinic receptors. Nicotine have nicotine has very low affinity for muscarinic receptors. Then acetylcholine in the mid, and most affinity and the highest affinity is presented by muscarine on muscarinic receptors. While in case of nicotinic receptors, lowest affinity is shown by muscarine on nicotinic receptors. Acetylcholine shows again intermediate activity, while nicotine shows highest affinity for nicotinic receptors. That's all about the receptors. If you haven't understand any concept, just shoot a comment. I will address the issue there. Hope you have liked the video. Thank you so much for watching this video, and stay tuned. There are a lot of videos coming about the cholinergic agonist, cholinergic antagonist, and many more about pharmacology. So stay tuned. And unless this is Zohaib Tahir from ZMeds signing off.